In this skill, if you find a patient that has a knee injury that's in such a position where you want to splint it as it lies, you're going to need to have 2 medium padded boards. You'll need to have 4 cravats minimum, even though you may only use 3, but possibly 4, and 1 or 2 pillows of appropriate size to support the leg. As usual, take standard precautions before you begin your skill. Always check your neurovascular functions of pulse, motor, can you wiggle your toes? Sensory, can you feel me touching you here?
Yes.
And all that. And as an alternate, you can also check for color by sight, tint, and capillary refill. To begin the skill, you'll need to lie out your padded board splints. Pads should be against the patient. And have your cravats ready. When you have tied the boards on, we'll create a type of cradle hitch by lying one just proximal to the knee, about 2 inches away, crisscross it underneath and make adjustments as necessary so that the pads remain to the side of the patient. And with your first one, you'll actually tie it off using a square knot to the outer aspect, is the lateral or hard side of the board. Don't bother tucking them in yet. Do the same thing, more proximal to the leg, just opposite. With this triangular bandage, once it's under the leg, again, crisscross it underneath the leg, creating a cradle hitch. Pull it snug. Then again, tie a square knot to the side of the board so that the leg is secure. If it loosens up, you can make adjustments to tighten it later. Then, with the boards that are left over, you go around the leg once, or perhaps twice, simply in a circular motion, and tie, again, the square knot to the lateral aspect of the board. If the size of your patient allows you to, you can apply a last one as the most proximal of your cravats, and again tie a square knot to the lateral aspect of the board. Tuck in any loose ends so that you don't accidentally catch those. And obviously the patient can't be transported fully supported with the boards alone, so you'll need to take 1 or 2 pillows. I'm going to put those underneath the leg itself and move the patient by way of long spine board after you've checked pulse. Can you wiggle your toes? You feel me touching you here?
Yes.
Again, color by sight, tint, and capillary refill. You ready to transport your patient? If we have an elbow for splinting in a type of joint injury, there's some modifications you'll probably have to make. In this case, we're going to end up using 2 short arm boards, one on the other side of the joint. And as usual, you'll have to take standard precautions, and you'll need to check your neurovascular functions by checking the distal pulse. Can you wiggle your fingers? Motor. Sensory. Can you feel me touching you?
Yes.
Color by sight. Temperature. And cap refill. Gather your equipment. You need 2 small arm boards and a minimum of 2 cravats to apply the actual board splints, and then 2 more to apply a modified sling and swab. In this case, if you have a calm, cooperative patient, you can have the patient assist you by holding one of the splints underneath at an angle, leaving room that you can create a type of cradle hitch. Take your first cravat, and what we'll do is we'll come through the juncture of the elbow, and we're actually going to go over the splints, creating our cradle, and come back across the top. And as always, we want to make sure and tie a square knot to the unpadded side of the boards. The pads actually need to be against the patient. The tails we'll come back to in just a moment. And again, you'll need to crisscross your cradle hitches that you create. And tie your square knots to the top of the board. For this patient, 2 should suffice. Tuck your ends away once you're sure they're on as tight as you wish them to be, because we don't want them to catch on anything. And for our modified sling, when we take the cravats out of the package, I would just leave them about 4 inches. You're going to need to come up underneath at the area of the wrist. The patient can relax their arm as best they can. If you need to fill in the area because they can't actually adduct it to their body, you can fill in with a pillow. On the uninjured side, not over the spine, tie another square knot. And last, take your last cravat, and you're actually going to need to come around the patient underneath the uninjured arm, and again tie the swab off to limit movement and tuck that away. Lastly, always come back and recheck your neurovascular functions by pulse. Can you wiggle your fingers?
Yes.
You feel me touching you here?
Yes.
And optionally, you can check color, tint, and again, capillary refill for those patients that don't have fingernail polish on.